My name is Silus, and the doctor has ordered an NG tube insertion today. The first thing I will do is implement the standard protocol by checking the doctor's orders and compare them to the MAR. And then I will check the type of the NG tube that is being used for the procedure, which is the Salem sump, and its purpose, which is suctioning. And then I will get all my equipment, take it to the patient's room, and introduce myself to the patient. Hey, Mr. Jackson, my name is Silus. I'll be your nurse today, and the doctor has ordered an NG tube insertion for you. Can you state your name and date of birth? Okay, then I would verify with their wristband, ask if they have any allergies. Then I would assess their nares and their oral cavity, so that make sure they don't have any deviated septums, any nasal surgeries. And I would also ask the patient to occlude one nair and breathe in and out, occlude the other nair, breathe in and out. Okay, the nairs are patent, but I will be using the right nair today. And I will prepare my tape for the procedure. I've already prepared it. Okay, so now I will measure the NG tube. I will measure it from the tip of the nose to the ear, and then from the ear to the xiphoid process. And I would place a tape marker there. Okay. Then I would apply clean gloves. I would have the patient in a high Fowler's position, but since this bed does not move, the patient will be in almost Semi Fowler's. I would and lubricate my NG tube about 4 inches. 4 inches. And then place it aside. Then I would place the towel on the patient's chest. And then I would tell the patient that the procedure is about to begin. I would tell them to tilt their head backwards just a little bit. And then I would insert the tube a few inches. If I feel any resistance, I would ask the patient to bring their head forward. Would advance the tube. Then I would check for any coiling in the back of the throat with the pen light. No coiling is seen. Then I would keep on advancing the tube as the patient sips water. Right? And I would advance till the tape marker reaches the bridge of the nose. Okay. Right? And then I would temporarily connect the tube, secure the tube to the tip, to the cheek with a piece of tape. Then I would verify placement by asking the patient to speak, and I would also check the back of the throat with my pen light to see if there's any coiling. Again, no coiling is seen. I would take my syringe. I would aspirate for gastric secretions, and if it's a hospital policy, I would check the pH. The pH would be has to be 4.5. Then I would take 10 milliliters of air. Then I would take my stethoscope. place on the patient's left epigastric area and listen for a swishing sound as I push the air in. Swishing sound is heard. Okay, then I would measure the tubing and compare it to the baseline. Okay, then I would anchor the tube with the tape to the nose. Then I would take another piece of tape and put it on the patient's bridge of the nose. Okay. And we'll disconnect this one. And then I would take a safety pin and a rubber band and fasten the NG tube and the rubber band to the patient's gown or the shirt, and then I would connect the tubing to the suctioning, low intermittent suctioning, and then I would tell the patient that they will receive an oral hygiene every 2 to 3 hours. I would use the completion protocol of assessing for any pain, if they have to go to the restroom, if they have all their personal belongings with them, such as a collie, and their position, whichever is comfortable with to them, such as Semi Fowlers. And then I would document the time and the date of the insertion, the length, size, and the type of the NG tube that was used, the color and the character of the secretions, any patient teaching that was done, client's response to the procedure, and also I would look at the intake and the output record and record the amount of drainage, and also if pH was conducted, I would obtain the number. Okay, so for the irrigation, I would implement the standard protocol again by having the patient as Semi Fowlers to high Fowlers position, but this bed doesn't move. So I would apply new gloves, and then I would disconnect the tubing from the disconnect the NG tube from the suction, and I would place it on the side with a towel. I would obtain the gastric secretions. Okay. Then I will reintroduce the gastric secretions or an air bolus, and I would listen for a swishing sound again by placing my stethoscope on the left epigastric region. Swishing sound is heard. Okay. I would clean my syringe just a little bit, and then I would instill 30 milliliters of water. And I should get 30 milliliters of water back. I would measure it and discard the instilled amount. If, for instance, if I got only 20 milliliters back, I will record the 10 milliliters as intake and 20 milliliters as output. And then I would reconnect my NG tube to the intermittent suctioning, and I would inspect for color, volume, and the character of the NG secretions. Um, I would implement the standard protocol, implement the completion protocol by asking for any pain, if they're comfortable, if they have to use the restroom, and have all their personal belongings with them, and have their bed again in the Semi Fowler's position. And then I would document the type and the volume of the irrigation solution, the difference between the volume that was instilled and the volume that was returned, and characteristics of the returned solution, any difficulty irrigating the tube, any client teaching that was conducted, and patient's response to the procedure.